Senator, this was a complex meeting, but to try to boil it down for the lay person, what's going on? What's at stake? What's your concern?
Basically, again, you're right. It's incredibly complex, but what this is all about is because Oklahoma is Indian Territory and because we have such a large population of Native Americans, as the governor moves us towards a managed care Medicaid state, which is a specific type of insurance plan basically for Medicaid recipients, we have to be very careful that we treat that Native American population correctly. And what we found out in today's meeting is that if we don't have the right language in the contracts and we don't do all of these things right, it could be up to $150 million that the state will have to find in their budget. And that's the bottom line for why we need to have this conversation.
And I guess to explain to people that right now, Native Americans, because of a benefit they get through an agreement with the federal government, their health care is 100% reimbursed, as opposed to non-tribal healthcare systems where it might be a 60-40 split. The state has to come up with 40%. And they were saying, under the current numbers, if that 40% of Native American health care had to be picked up by the state, that would cause the state an additional $88 million a year, even before expansion.
Right, before Medicaid expansion, I mean, we're talking about last year's numbers. The federal government paid $88 million that typically a normal state would have had to pay that. But because we have such a big Native American population, the state is not required to pay matching funds for the Native American population. And so the federal government comes in and pays that match for us. And so it's $88 million looking back. Looking forward, once we do expand Medicaid, that number goes up significantly. It could go up by another third. It could be $125, $130 million.
So at this point, are you just trying to raise awareness, educate fellow legislators about what's coming down the track?
Absolutely. I want to make sure that this seemingly small detail doesn't get ignored, doesn't get forgotten, doesn't get messed up, because in other states this is a blip on the radar. And so when you start to do these types of contracts, there are very few states where this small section of the contract could be so big. And so I want to make sure that in Oklahoma we go in with our eyes wide open, that what in other states is a small thing, in Oklahoma is literally $100 million a year in taxpayer money that we could have to bring that $100 million in new taxes in if we don't get this right.
Now, one of the things that was brought up, the cost would be borne by the state, not the tribes, and yet you had representatives of the tribes saying they don't want Oklahoma to incur that cost. Absolutely,
and that was one of the biggest things that everyone agreed on here, is that this is a moment when what is good for the tribes and the members of the tribes is the exact same thing that is good for the state of Oklahoma and every person in Oklahoma. That this is not a place where the tribes and the state shouldn't be aligned. We're all perfectly in sync. It's just a matter of making sure that we get this right.